Push from several healthcare providers to learn more about exactly who is getting it.
Medical reporter Liz Bonis shares why some say we need to be gathering data not just by age and gender, but also by race.
This Facebook post that got shared repeatedly and brought people into the streets of Cincinnati, Ohio this past week.
That's how we doing in my city, man. We don't give a about the coronavirus. It's how we celebrate our coronavirus.
Not only led to the arrest of Rashawn Davis, it led to public health specialists such as Dr. Owens sounding the alarm.
And I'm told that that is not the first one. There's been a series of these things around the city. And for some reason, there's a group of African Americans that think that somehow they're immune because they were told that people who have malaria in Africa may have some protection against coronavirus, which is not true.
To clear up the confusion, certain malaria medications with antibiotics may help some people fight off the virus. But Dr. Owens told me nobody is immune to it. He's part of Interact for Health, which gathers data through community surveys, and he says reporting coronavirus by race will help educators know which populations to target.
I think, again, when you start looking at urban cores, if you're going to look at Atlanta, Chicago, Milwaukee's where some information came out, those are areas that have a fair amount of African Americans. The problem that you have is that you tend to be in the city, you tend to have multi-generations. It's not unusual for grandma to be in the house with the grandkids. And that becomes a real problem when you want to try to do social distancing.
Do you also think it's important to find this out, though, because we do know that certain ethnicities are prone to things that can be high risk or comorbid conditions, high blood pressure, for example?
Oh, absolutely. African Americans have a high proportion of hypertension, as well as other underlying problems, a higher incidence of kidney problems, diabetes. And those are the people that tend to not survive if they get the coronavirus.
It's clear, Dr. Owens says, that anyone of any ethnic background can get the coronavirus. He says the whole world is getting sick. But if we don't find out numbers by race, we won't know if it hits some races especially hard, and the best way to interrupt it when we likely get a second wave. I'm medical reporter Liz Bonis reporting.